The FDA and CDC signed off on COVID-19 vaccines for infants, toddlers, and preschoolers. The White House is making about 10 million doses available for that rollout. Here in New York City, the health department begins offering the vaccine today at hubs in all 5 boroughs. All this happening as the city moves down into medium risk on the COVID-19 alert system.
All right, we're going down. Joining us this morning, New York City Health Commissioner Dr. Ashwin Vasan. Nice to have you back on Good Day New York.
Good morning.
So what do you attribute the COVID numbers going down to? Is there something you could put your finger on?
Well, look, I think this variant has behaved in a different way. We have more tools than we've ever had before, including new treatments which are available at scale that we haven't seen before in this virus. And we've had a lot of people get vaccinated, which has created a really high wall of protection. So I think taken together, this is, the natural way that this variant behaved. It's taught us a lot about what to expect for the weeks and months ahead in terms of preparing for the fall. And we're really glad that New Yorkers have taken the steps to keep themselves safe and their communities safe.
So, Dr. Vasan, I know so many people who've gotten this variant, so many, a lot of them home tested. So I guess the city would really not have an idea on the numbers of people who tested positive. Wondering, are we at herd immunity? Like, is this, are we seeing the end of this pandemic?
I think we're somewhere in between the emergency and endemicity, which means like a seasonal virus. I don't know exactly where we are in that process, but we're somewhere in between. And so in this transition phase, it's expected to see a lot of people infected because the virus is getting more infectious. But we do have a lot of people who have been vaccinated. We do have treatments which are, for the first time in this pandemic, keeping people out of the hospital. And so we're seeing this break between cases and hospitalizations for the first time, which is an encouraging sign.
And Doctor, the big news today, obviously, is that these vaccines will be available for the youngest Americans. What do you say to parents out there who may be a little hesitant to give that vaccine to kids under 5, as old as 6 months?
Yeah, we understand hesitancy. We understand that parents are going to have a lot of questions. I'm the father of a 3-year-old. I know that this vaccine is safe. I know that it's effective against COVID and against its most severe complications. And so I can't wait to get my child vaccinated. But I understand that parents have a lot of questions, which is why we're recommending their first call be their pediatrician. We know that the pediatrician is such a trusted source of information and education around medical choices for their child. So start there. But we are also, of course, standing up city-run vaccine sites, about 10 of them across the city for the next 8 weeks, to assure that people do have access to the vaccine, even if they don't have a pediatrician or if they can't get an appointment with their pediatrician. So we're trying to balance those needs. And we're here as well to offer that reassurance, that guidance, and to answer any questions that parents might have. This is a big decision, but it's also an exciting time. We've been waiting 2.5 years for our youngest and most vulnerable kids to have access to this vaccine. And that day is finally here, and we're very excited.
How big of a problem is it, or has it been, for kids in this age group in terms of spreading the virus or spreading it to each other, whether it's in a preschool or things along those lines? Has that actually been a source of community spread that has registered within the health department and sort of kept this thing going over the last 2 years?
Well, look, kids, there are far fewer kids than there are adults. Kids are far less mobile than adults are, and they put out a lot less respiratory breath and secretions than adults do. So, of course, they're not as transmissible or causing as much spread as adults, but they're also our most vulnerable kids. Their immune systems aren't fully developed, and what we're learning every day about long COVID and its complications, we didn't want to continue to play Russian roulette with our kids, and the vaccine is going to step us a long way towards protecting them. And so, we're really excited about getting this vaccine out there and protecting our babies.
All right, doctor, something else to worry about, or maybe not worry about, monkeypox. Tell us, should we be looking at this? Who should be concerned about it?
Well, look, we currently have 25 suspected cases of monkeypox in the city. So, when we talk about the scale compared to something like COVID, this is much more contained, much smaller. And this is a far less infectious pathogen, right? This does not spread through breathing or singing or talking. This spreads through skin-to-skin contact, close physical contact between two human beings. And so, the risks are far less than they are for COVID. Also, this is not a fatal illness. This is not something that's going to put you in the hospital or cause severe disease. This is largely a viral illness and a skin rash, which ends up resolving on its own. So my message to New Yorkers is that anyone can certainly get monkeypox, but the risk has been highest in the gay population, bisexual men, and men who have sex with men. That's just based on this outbreak, nothing inherent to monkeypox in particular. And, we're trying to maintain a balance between really messaging clearly to the affected community in an appropriate way with timely information and resources without kind of creating this widespread nervousness. And look, I get it. Everyone's tuned up to public health and tuned up to infectious diseases because of COVID, but this is like apples and oranges.
And Doctor, one other major headline today, Broadway has decided that they're going to relax their mask mandate next month. Are you okay with that? And at this point, as the city's top health official, is there any scenario where you feel uncomfortable without a mask on inside? Are you comfortable just wearing your mask without your mask any place that you go at this point?
Look, I mean, the fact that cases are falling, that hospitalizations are falling, and that we're moving into a lower level of risk, I'm hopeful by the time the Broadway mask mandate is lifted that we're actually down into low risk. If we continue on this trajectory, that could be the case. And so that's all optimistic, and that's all, that makes sense. And look, I think we're at this point in this middle period between emergency and endemicity where New Yorkers are going to have to make some smart choices for themselves. They're going to need to decide whether they feel comfortable wearing a mask inside or not, and what their home situation is, what their family situation is, what their underlying health risks are for themselves. And so that masks are an important tool to keep one safe, to keep others safe. And we're asking New Yorkers to use that, in a way that makes most sense for them. Right now, in a medium risk environments, we're still recommending masks in indoor settings. But as we move into a lower risk environment, we're gonna make this a choice that people can make. And I think you're gonna see people choose to exercise that in different ways, and everyone should feel free and not feel stigmatized or in any other way discriminated against because they choose to wear a mask. I mean, it's a piece of cloth.
Right, exactly. Dr. Vasan, we all like choices. We don't want to feel like we got Big Brother looking over us every 5 seconds, you know what I mean? But we did get through a very tough period, and we appreciate your advice this morning, Dr. Vasan.
Thanks so much. Glad to be here.
Okay.